Meningitis. We're on page 41. All right, let's read through what this is. Do we know what the meninges is or no? Your meninges, not meningitis, your meninges. It's essentially a layer around your brain and your spinal cord, okay? It's like a layer of fluid where a lot of the cerebrospinal fluid is kept. So when this develops an infection, or in this case, right, an inflammation, which is usually caused by infection, it is meningitis. So, meningitis is an inflammation of the meninges, which are the membranes that protect the brain and the spinal cord. Viral or aseptic meningitis is the most common form of meningitis and commonly resolves without treatment. So we have viral, also right called aseptic. Common, the most common form, and resolves without treatment. Okay? Fungal meningitis is common in clients who have AIDS, and we'll go a little bit deeper into that when we cover HIV and AIDS. So for now, let it be. Bacterial or septic meningitis is a contagious infection, high mortality rate. The prognosis depends on how quickly care is initiated. There are 3 vaccines for different pathogens that cause bacterial meningitis. One is available for high-risk populations, such as residential college students, which is required for college entrance. So bacterial or septic, right? We put here dangerous. More than anything, not scrutiny. The more important thing is that it's contagious. And by dangerous, I mean high mortality rate, meaning you are likely to die. And this depends, high mortality. And this will depend on quick treatment. How quick you begin treatment. The later you leave it, the more it has progressed and more difficult to treat, and you are more likely to die. So the faster you deal with it, the better situation, the better prognosis. Okay? So these are the 2 that we're really gonna kind of like focus on differentiating and what's gonna happen. Like what are we doing here? As we saw, for viral, we'll look over it real quick, skip over to risk factors on the right side, page 41. At the top it says risk factors, and look at viral meningitis. Essentially, it's caused by a viral illness, things that can happen either way, like mumps, measles, herpes, arbovirus, which is the West Nile virus. So these are viral infections, and there is no vaccine for viral. Okay? Viral. No vaccine. And essentially what happens with viral is you develop this viral infection, you have mumps, measles, West Nile, and what happens is that it will eventually spread to the meninges. Like again, you were having this virus, and it happened to spread there during your illness. So that's why hence, not really much prevention for viral meningitis, because we have vaccines right for measles, mumps, rubella. Now, for bacterial, look at the bottom left side, and you have 3. You have the Haemophilus influenzae, which is also called your HIV. You have the pneumococcal polysaccharide, PPSV. And then you have the meningococcal, or MCV4. Now, I'm not gonna write out the names, but you have them there, right? See right here. And we're gonna read for them. So Haemophilus or the Hep B, this is the one for infants, for kids. Ensure infants receive vaccine for bacterial meningitis on schedule. Series of 4 doses is recommended beginning at 2 months of age, with the final dose at 12 to 15 months. Okay, so that's for kids, don't forget. Pneumococcal, though primarily intended to prevent respiratory infection, this immunization decreases the risk for CNS infection. Vaccinate adults who are immunocompromised, chronic disease, smoke cigarettes, or live in long-term care facilities. Give 1 dose to older than 65 who have not been previously immunized. This is for older adults. People with respiratory infections or problems are at higher risk. The Hib is for infants, given to children. And lastly, and this is probably the most significant one, is the MCV4, or the meningococcal. Ensure that adolescents receive the vaccine, so it's for beginning adolescents, on schedule and prior to living in residential settings in college. Individuals in other communal living, that's what we're gonna call it, communal living, or another way to say that is, it seems more familiar to you, is close quarters, dorms, such as the military, also should be immunized. An initial dose is recommended for healthy children between the ages of 11 to 12, with the booster at 16. Now, this can also be given to older adults in SNFs because they live in close quarters. There's 3 of them to a room, right? In military, the barracks, right? They're just spread, bunk beds, one on top of another, one on top of another. But they're really, really close together. In dorm rooms, again, right? You're 3, 4 to a little tiny room that's in a closet, and then this dude went over there, and he went to this room, and blah, blah, and Sally's with Kelly, and blah, blah, and all this, right? And so like it's very close quarters of everybody intermixing. And so bacterial meningitis is, what kind of precaution? Droplet. Okay? So with that, it spreads easier. It's very contagious. Okay? And so meningococcal, the question that I see asked that I want to emphasize to you is that they'll say like when they say who is a candidate for MCV, you should know who. College students and military are the 2 top, or if they say anything to that effect, like they have a close quarter living or a lot of people to one setting, these are people who should get the MCV4. The other way is, they're gonna tell you, hey, there's a student that's going off to college. The nurse should know that which of the following vaccines is recommended, and you need to know which vaccine it is. That's why I list out the 3 of them for you, and tell you which age group they belong to. Does that make sense?
Yeah.
So in short, you need to know the vaccine name and the age group or reason of who's getting it. Yes? Or bacterial. It's very easy to differentiate because viral doesn't have one. You're preventing it by preventing the viral illness. Yes?
For the one where this is like the older and respiratory, what's the like the older, but then they're gonna live in like would they get both or just?
You could get, so most of you have the Hib. You got it as a child, and assuming, again, you either would keep up with your doctor or whatnot, you probably also got the meningococcal. So you can have it, and as you get older, you'll get the PPV. Now, someone older probably didn't get these, but yeah, so then they suddenly come, and then a doctor's like, hey, have you been vaccinated? Like, no. They could probably give them both. But sometimes they have to be spread out, and that's irrelevant to the test. Sometimes certain vaccinations you have to spread out, or do them differently. Certain ones.
Sorry, bacteria is the droplet.
Yeah.
The bacteria is
The bacteria is a droplet. Viral, not really.
Communal what? Communal. Communal living or close quarters.
If it's something that affects your brain, go for it.
Because while it is the meninges, it's your body that overall carries the pathogen either way. A lot of the ones that cause this are streptococcal infections, that's why. I think it does state it out, yeah. So, the bacterial is caused by, Neisseria meningitis, but then the streptococcus and Haemophilus influenzae. So these are ones that reside. You don't just get it specifically like, unless you have trauma, it didn't specifically get to your meninges. Does that make sense? Like you're not passing it from meninges to meninges. You're developing from a bacterial infection that you're having, and it's spreading to the meninges.
People who like don't have healthcare insurance, which is like a good amount of people, and strep is such a common thing, like, wouldn't this be much more of a bigger issue?
So most people, for one, like you're saying, are vaccinated though, as kids. Hence the prevention. A lot of people underestimate how much of the immunity you've gotten as a child because of the vaccine. Now, the second point to what you're saying is, what happens to people who get strep throat? Okay? What are complications of strep throat? No, I'm talking about, I'm not sure if you guys were aware of this, because again, we covered this usually in fundamentals for infection control. Strep needs to be treated. Thank you. If you do not treat, this is irrelevant to the meningitis, but strep throat, usually caused by group A, if it goes untreated, especially in children, later in life they will develop
Rheumatoid. Heart fever.
Or they can develop just overall scarlet fever, or it can spread and attack and this is if the strep is untreated.
Now there's a fluctuating
There's always been, especially from oysters and seafood, which hence they eat a lot of. There's a lot of bacteria, like a lot of flesh-eating bacteria. So, if left untreated, this will develop because the bacteria remains in the body, and so then it'll develop eventually when the immune system goes low. Make sense? So, to answer your question, you're like, without healthcare, what happens? They die. Like, the people can die from this, like, and they develop it down the road. So you try to treat it with antibiotics then and there. So, I hear you because it is a concern. Most people just, everybody knows, like, if you don't treat strep throat, what's gonna happen? It's gonna go away.
It goes away.
It'll go away in 5 to 7 days.
But then it'll come back eventually.
But hence you're getting treated.
Yeah.
And you can develop this. So, and then if you don't, people go like, well, what happens? Well, yeah, like these types of things can then happen. So, or you just get some antibiotics. Go get some amoxicillin. That's all they do. Is just amoxicillin.
Yeah.
They're just like 7 days, 14 days, take it, and then.
Do you guys have, how many of y'all have tooth pain? Okay? Do you know what happens when you don't treat? Eventually it'll go to root canal, and as it's invading the gum, what are you gonna suffer from? You could develop infection and sepsis and just die then and there, but if not, it's not a joke. You're so vascular and so, why do you think it hurts? So hold on. Jokes aside, it's very, you hit on it. So, apart from the fact that it can just spread into the bloodstream and you'll develop sepsis from it, you can. Rare, but you can. The other cause is, it is so linked that if you've had ongoing or bad treatment of your gums and teeth, you develop heart disease. Because the bacteria is affecting it. Huge link to it. Like, no. If you don't take care of your mouth or teeth, you develop heart problems. Okay? Look at all of y'all that are gonna brush your teeth tonight.
Depends on quick treatment
Hey,
for
people
bacteria.
are saying you should, but I promise you, there is one person today, at least, statistically speaking, you didn't brush yesterday.
Ew.
Or today.
I brush every morning and night. Gross.
Okay?
I brush every morning and night.
Well, if you don't brush your teeth, you can get
Are we good? The strep can attack the kidney or the heart. It's the two common ones that it attacks.
Carditis.
Okay.
Nephritis.
So, real quick recap since we steered off just a little bit for additional knowledge. So, meningitis, you need to know there's viral and bacterial. Bacterial is contagious, more dangerous, high mortality rate. Viral will resolve on its own. Usually you help treat the symptoms. Keep the fever down, keep them comfortable. For viral, no vaccine. Bacterial, you have 3, and you need to understand what they are. Remember the names, they're not gonna say HIV, okay? It'll say Haemophilus. So make sure the names are in the bug. And you need to know then what do they belong to, like who should get it? Infants get these. This is something that's just standard that you give in infants. Older adults, people with respiratory problems, or who are at high risk. And then close quarters living, and this is the one that I most commonly see asked as part of med-surg or fundamentals as infection control. Okay, the MCV4, meningococcal, needs to be given to close quarters people. And they can phrase that question in a number of ways. Yes? Okay. Yes.
So the MMR vaccine doesn't count for the viral?
MMR prevents measles, mumps, and rubella, which if you can't get those, you are unlikely to develop.
Bacteria is good.
But to say that the MMR vaccine is to prevent meningitis is inaccurate. But yes, you're on the right track. If we prevent measles, you're not gonna get viral meningitis. Because again, this happens that when I get measles, it'll eventually affect, or can, the meningitis. But if I prevent measles, I am preventing. Yeah. So there is vaccines for those disorders, but not to protect you from the meningitis. Like I can't let you get measles and just specifically prevent you from meningitis. That's not what the vaccine does. Yeah. Make sense? Okay. So we're good with the recap. All right. Next important thing, and they love to ask. Meningitis is one of the most like prominent things. Like I go through meningitis slowly and carefully because it's one of the disorders that it's like when I say like a beautiful disorder, there's key things to know at every point. In the sense that in some of them, like when we've done certain diagnostics for diseases, I can tell you like they like to ask about just like what to prevent, right? Or like how do we treat? But meningitis has a key point at everyone. We see the differences in acknowledging which one we're having, how to prevent it, there's vaccines out there and who should get them. And then now we're gonna do expected findings. How do you identify that someone's possible meningitis? And then there's specific treatment. So it's like key at every point and they can ask you about any of it. Make sense? So we got risk factors, we got the types, vaccines, so now for prevention. So now expected findings, and they're pretty key. All right, expected findings. Subjective, meaning what they're gonna tell you, okay? Well, let's look at the first one. Excruciating, which means very horrific headache. And I should say, it's constant. It's not like here, maybe sometimes.
Is this for all meningitis in general? Or
Generally, yeah.
Oh, okay.
The headache is a huge factor because hence the inflammation is what's causing it.
Okay.
Nuchal rigidity. This one is pretty like one of the, I'd say, like I'm gonna do some that are like stars, and this is what makes it stand out is what I'm trying to say. Because the reason why I put that is because we've all had headaches. But you don't think I have any headaches. But if you have these symptoms and then this is present, this is the determining factor. Like a lot of people show up with headaches. But then they're like headaches, fever, and my neck is stiff, like I can't move it. That's an immediate, like that's the red flag that will trigger any like doctor or healthcare to test you for meningitis. Like we need to get test diagnosis. It's a stiff neck. And we'll explain why. And then paired with photophobia. Sensitive to light. We know what photophobia is, right? You ever had a migraine? Can't stand the light and it bothers you, right? Okay, now objective data. So they have an infection, so they will obviously develop
Chills.
fever and chills. Okay. Nausea, vomiting, okay, right? Nausea, vomiting. Altered level of altered level of consciousness. Okay? So confusion, difficulty arousing, disorientation, like they're not themselves anymore mentally. Right? You speak to the people here around your classroom on a daily basis, you quickly be able to tell that they're not themselves, they're confused, disoriented, they're lethargic, they're out of it, right? Altered level of consciousness. Now I'm gonna put down here positive for a Kernig's sign and Brzezinski's. And I'm gonna show you a video of what that looks like apart from explaining it here. Hyperactive deep tendon reflexes, that's one as well. Tachycardia from their fever, right? Their tachycardia. They can eventually, from the pressure and fever, develop seizures. This is pretty unique to it as well. A red macular rash. This is for meningococcal meningitis. And then restlessness and irritability. Now I'm gonna highlight this. Irritability. Now I'm just gonna put like a little point here, right? 3 points. Just because restlessness and irritability is, well, it's not like right, like specific to meningitis. It is one that I commonly see that they like to include, like in select all that applies or stuff like that. The fact that they're restless and irritable, like they're like, because again it hurts and they're like confused and they move around, they can tend to move around a lot. So restless, irritable is significant. Now as for hallmark, key signs that like are so specific to it in a sense, this one right here, which is one, because you do these together, the Kernig's and Brzezinski's. Okay? This should alert you to the fact that you have a infection. It's not just like a headache or a migraine. You're developing a fever and chills. This is obviously an infection. So you see, if I just come in for headaches, okay, when did it start? 2 days ago. Anything else you've noticed? No, my head is yeah, like there's very little to do. This, I had a fever, he's confused, he doesn't really know where he's at, blah, blah. Now you start pairing all this together, and then they try to move his neck or anything like that, it's really stiff. Now you have a higher suspicion, because now you're putting it together. Does that make sense? Now remember, this is what the book says, but you need to be able to interpret this. Because we can say stiff neck or nuchal rigidity, but if they say like what I just described, like the patient is here, when attempting to turn their head or anything like that, their neck feels stiff or it hurts, or does that make sense? You're stuck looking for nuchal rigidity, then it's a problem. They're confused, lethargic, disoriented, ALOC. Does that make sense? I need you to be able to interpret and put together, not just memorize literally word by word what it's saying. Because they'll describe it to you. They like to give you patients now and describe what's going on with them. So you have to put this together. Yes? And these are the little key ones that kind of give it away. The other ones obviously can happen to people, but as we start putting this full picture, this is describing meningitis. The fever, migraine, photophobia, irritability, stiff neck, and then you see a Kernig's and Brzezinski's, you're like hallmarking meningitis. Now you can't just say, you got meningitis. We're gonna obviously diagnose, and we'll go over that right now. But first, let me show you the video.